Hello, beautiful people. It's another time. This is concise nesting. This is where we make nesting very, very simple. Today, we're looking at something very, very simple, very snappy, and then quickly we will knock off. All right, so most of the students keep asking, what is the difference between signs and symptoms? Signs, anytime we say signs and symptoms, when we say signs and then we add symptoms, what does it mean? Signs and symptoms of a particular condition, signs and symptoms of particular anything. All right, so quickly let's look at it and then we will knock off. All right. Somebody taking care of you. All right, that indicates a disease or injury. All right, so these are things that will show to the person looking at you. All right, so if it's a nurse looking at you, the nurse is going to say that, okay, this and this is happening to the patient. This and this and this are happening to the patient. All right, so nurse can see that patient is pale, which we refer to as pallor. If patient is pale, the nurse who sees it. All right, if patient is bleeding, nurse can see that patient is bleeding and say it. Deformities, patient has any deformity, being it congenital or something that you're carrying this out. Temperature, patient can measure and then know your temperature, can measure your pulse and see it, can also observe your respirations and then talk about it. So this is objectivity, okay? The nurse or the medical personnel sees about the patient and then talks about it. It's what you call the signs, okay? So they are clear and then you can see it. All right, when you talk about the symptoms, these are sensations that the casualty feels and describes it. All right, so these are things that the patient is the one who's going to tell you, okay, Papa nurse or Papa nurse, this is what I feel, okay? Papa doctor, this is what I feel, or this is how I feel. All right, so it could be feelings of discomfort due to cold, heat, pain, nausea, thirst, etc. So these are subjective. All right, so this is what the patient tells you. So signs are what you, the medical personnel, can see and then you can find out. All right, and the symptoms are the things that patient will tell you that they feel based on what is going on in their body. All right, so that is that about signs and symptoms. If you have any questions, please drop it in the comment section and we will respond to it as quickly as possible. All right, thank you very much.